people that are wishing to give public testimony today, we're going to need to limit time to 1 minute so that we can get through as many people as possible, hopefully 50. When we call your name, please unmute yourself. You'll have 1 minute. At the 1 minute mark, staff will mute you again, and we will announce the name of the next person and move through as many people as we can. We will be calling people based on those who have pre-registered prior to the meeting. If you do not get called on today and you wish to submit a written comment, if you have not done so already, you can submit written comment to wsboh@sboh.wa.gov. For individuals who have dialed in and are listening by phone, public comment will only be available to you by submitting written comments today. You need to be on the Zoom webinar to be able to make verbal public comments today. So with that, we're going to go ahead and get started. Each person will have 1 minute, so please be brief and concise. If appropriate, please state your name and affiliation. And otherwise, at the 1 minute mark, we will remute you and move on to the next person. So Kate and Nathan, could we have person number 1, please?
Looks like the first person that we have here is Deborah Hibbs. I'm going to allow you to unmute yourself in just a second here.
And Nathan, would you tell who's going to follow Deborah so we don't lose a lot of time?
Yes, absolutely. Okay, I'm actually having issues with Deborah Hibbs at the moment. Looks like she's using an older version of Zoom. I'll go on to the next person, which will be Deborah Barrel. Give me 1 second, Deborah. Okay, Deborah, you should be able to unmute yourself.
Hi, yeah, can you hear me?
Yes, absolutely.
Okay, good. My question is, or my comment would be, the talk that the vaccination protects you from symptoms from COVID, but what about the symptoms from the vaccination? If you look at the VAERS reporting, there are so many symptoms from the COVID vaccine that we should not mandate that. And also I wanted to find out how to get on that non-elected members board. Has that been determined yet?
Thank you, Deborah. Is that the extent of your comments for today?
Well, if I have a little bit more time, I was just wondering if you read about the 145 countries that found that the jab causes 38% more COVID cases per million and 31% increased deaths per million. And
Okay, thank you, Deborah. Apologies, we're out of time. We are going to move on to the next person, Todd Alred, and then after Todd, it will be Lori Lane. So give me 1 second, Todd. I'll navigate to your 1 second here. Okay, Todd, you should be able to unmute yourself now. Are you there with us, Todd? You should be able to unmute yourself. Okay, it looks like Todd Alred is not here. We'll move on to Lori Lane, and after Lori Lane, it should be Dan Wood. Give me 1 second, Lori, and then I'll let you know when. Okay, Lori, you should be able to unmute yourself, and Dan Wood will be next.
Okay, do you hear me? I unmuted myself, or did I unmute myself? Let me see.
We can hear you.
Okay, gotcha. Hi, my name's Laura Lane, and I am a concerned citizen from Buckley. I have one question. What happened to choice with all this? with not just children, but adults too, with these mandates. I think that really needs to be given due consideration by you as a board. I think it's really important that people don't feel like that people have those choices, and we feel as a public that they're being taken away from us. I mean, there's something to be said also for natural immunity, and I find it curious that nobody has mentioned that at all in all that we do, and that's got to count for something, in my opinion. I really.
Thank you, Lori. We've ran out of time there. I'll move on to Todd now. My apologies. On to Dan, and then after Dan Wood, it will be Beth Rohr. Hold on one second, Dan. I'm gonna go ahead and try to unmute you here, and I'll let you know when. It actually looks like Dan Wood has disconnected from Zoom. I will move on to Beth Rohr. After Beth Rohr, it will be Lauren Guler. Give me one second, Beth. Okay, Beth, you should be able to unmute yourself here.
Hi, I'm Beth Rohr, and I am a concerned grandparent, also a retired public school teacher. You are meeting with this tag team partly to enact having school children add vaccinations to the schedule. I'm concerned about the WAC 246-105-060, which allows health officers to exempt the unvaccinated kids from school regardless of any exemption, because there could be an outbreak in the school. And so I feel there are you or whoever, any SBOH people, employees, unelected officials having the power to enact policies that have the power of laws that have not gone before the legislature. I'm concerned.
Okay, and thank you, Beth. And next up, we will have Lauren Guler, and after Lauren Guler, it will be Amy Holzel. Give me one second, Lauren. Okay, Lauren, you should be able to unmute yourself here. Lauren Guler, are you here with us at the moment? You should be able to unmute. Okay, we'll move on to Amy Holzel. Amy, give me one second here, and I'll be able to let you know when you can unmute yourself. All right, Amy Holzel, you should be able to unmute yourself here.
Hi, thank you. So my questions are a few. I understand in the beginning you stated that today you won't be discussing the quote detainment camps, and today you won't be discussing the mandate that's likely coming down the pike from Inslee regarding this jab mandate for kids 5 through 12. So I'm wondering, if not today, when is that going to happen? We've seen the camps, we know they exist, and I don't think it's a good idea to not answer and not discuss and to just put it under the carpet. I think that if it's there, you should talk about it, because not talking about it is going to create an uprising of which you will probably not even believe.
Thank you, Amy. We are now going to move on to Erica Griffith, and then after Erica, it will be Jessica Sawyer. Erica, give me one second, please. All right, Erica, and you should be able to unmute yourself at the moment. Erica Griffith. Erica Griffith, are you here with us? You should be able to unmute your microphone. Okay, it looks like Erica Griffith is not here at the moment. I will go on and move on to Jessica Sawyer. Jessica, give me 1 second here, please. Okay, Jessica Sawyer, you should be able to unmute yourself. Jessica Sawyer, are you here with us? You should be able to unmute. Okay, looks like Jessica is not with us at the moment. I'll go on to the next individual, Matthew A. Bumer. And after Matthew, I'll move on to Charles Kinsey. Matthew, please hold on 1 second here. Okay, Matthew, you should be able to unmute yourself here. Matthew A. Bumer, are you here with us at the moment? You should be able to unmute yourself. Okay, looks like Matthew A. Bumer is not here at the moment. I will move on to Charles Kinsey. Charles, give me 1 moment here, and I'll let you know when you should be able to unmute yourself. After Charles Kinsey, I'll try to move on to Tyrone Martinez.
Good afternoon, this is Charles. What I'd like to say is that I truly believe that this country, this state, all of our communities were founded upon the ability to choose for ourselves. And if we can't choose for ourselves and choose as a family what is right for our own children and our grandchildren and our children's children's children, then we have no right calling ourselves a free democracy or a free republic. And what I believe in is a civil magistrate that works to restrain crime, but never under any circumstances controls our conscience. We have that right written in the Bill of Rights to choose for ourselves. That's why we broke away from England in 1776, is because King George decided that it was his responsibility to choose for the people what was best for them. And so if we can't choose for ourselves, then there is no responsibility at the people, and we should stop calling ourselves a free democracy. So I hope that the council takes into account.
Thank you, Charles. I'm sorry we ran out of time. I will move on to the next individual here. It should be Tyrone Martinez, and then after Tyrone Martinez, I will move on to Megan Ruck. Tyrone, give me 1 second, and I'll let you know when you can unmute yourself. Tyrone Martinez, you should be able to unmute yourself now. Oh, yeah, there we go. I think it's unmuting and unmuting. You look like you're unmuted at the moment. Or my apologies. It looks like you're still muted, Tyrone Martinez. Okay, Tyrone, it looks like it's having issues with your microphone here. I will move on to Megan Reck. After Megan Reck, I will call on Bernadette Pager. Megan, give me 1 second, and I will let you know when you should be able to unmute yourself. Okay, Megan, you should be able to unmute yourself. Megan Reck.
Yes, I just want to make a statement as a parent, as an employee, that does not accept this mandate that is not a law, that this is not acceptable. You are infringing on our rights as a United States citizen that was given to us in 1776 to have a choice of freedom. You are enforcing something that is against everybody's law. You are ruining people's lives, and you are trying to put this on our children. I am not just saying for myself that I am angry, but for the rest of Spokane and the Washington and United States, that you should be ashamed of yourselves for sitting in that seat and not giving people honest answers. How dare you sit in your high chair and think you're better than us? We are all people of this United States. We should be treated equal, not belittled and be stepped upon like you are doing so freely and so, you are disgusting humans.
Okay, thank you, Megan. I will move on to the next individual here. Let me take a look on my list 1 second here. Oh yes, Bernadette Pager. After Bernadette Pager, it will be Ernest Quinn. Bernadette, give me 1 second here and I'll let you know when you can unmute yourself. All right, Bernadette Pager, you should be able to unmute yourself right now.
Can you hear me?
Yes, absolutely, thank you.
Thank you. I'm Bernadette Pager, Public Policy Director for Informed Choice Washington. Informed Choice Washington's rulemaking petition is your agenda item number 11, and we are asking you to adopt it. Our petition will create a new rule that will prevent you and any future board members from mandating emergency use products on children. The new rule will prevent you and future boards from mandating products on children that have not been properly tested, that have not been through completed phase 3 trial studies. We are asking you to look within yourself and find your humanity and your courage. We know you are feeling the forces of captured federal agencies and the forces of the money flooding to the state from federal agencies that will be threatened if you do the right thing and adopt our new rule. You have likely been contacted by large medical and professional associations that have a vested interest in vaccine programs, asking you to decline our petition. But you must do the right thing, if not for the children, then for your own soul. You do not want to face God having made a decision you knew was wrong and that put children's lives at risk. We are at a crossroads in America now. This fight against COVID measures and tyranny are happening in every.
Okay, thank you, Bernadette. We'll move on to Ernest Quinn. After Ernest Quinn, it should be Damian Hare. Ernest, give me 1 moment, please, and I'll let you know when you should be able to unmute yourself. Okay, Ernest, you should be able to unmute yourself now.
Yes, can you hear me?
Yes, thank you.
Sorry. So basically, I've got a question. As far as, no one knows the long-term risk of this vaccine. You remember that the member of FDA advisory committee famously said that we're never going to learn about how safe the vaccine is until we start getting it. So nobody, and we've already started hearing of people just having heart attacks, dying on soccer fields, football fields, what have you, plus the over 900,000 different side effects to this vaccine. Now, you folks don't even mention any of that, but you want to say how wonderful this vaccine is for the people, but you don't cover the whole bases. I feel that our whole government, health department is lying about all kinds of things, and the people deserve to know.
All right, thank you, Ernest. I'm sorry we ran out of time. Next individual will be Damian Hare. After Damian Hare, it will be Tammy Thomas. So Damian, give me 1 moment, please, and I'll let you know when you can unmute yourself. Okay, Damian, you should be able to unmute yourself. Damian Hare.
Hello, can you hear me?
Yes, thank you.
Okay, my name is Damian. I am a concerned citizen from Port Angeles, Washington in Clallam County, and I am currently being discriminated against by our county commissioners and health officer, as I and the rest of my family, cannot currently go and dine at a local restaurant. My comment here is in regards to the efficacy of what has clearly become no more than something similar to the seasonal flu shot. It is clear in your numbers shown earlier that the efficacy of reducing infection and transmission with the current vaccine in terms of the current variant Omicron has been a failure. At this point, it is obvious that for those under the age of 50, it is pointless to receive an initial vaccine or booster. And for those that are at risk, either immunocompromised or of older age, the vaccine should certainly be made available, but not mandated. Unfortunately, the data coming out does not indicate that the vaccine is improving symptoms and.
Okay, and thank you, Damien. Sorry we ran out of time. Tammy Thomas, you will be up next here, and after Tammy, it should be Michelle van der Morer. Tammy, give me one moment here, and I will let you know when you can unmute yourself. So one moment here. Okay, and it looks like actually that Tammy Thomas was here earlier, but is no longer showing up in the attendee list, unfortunately. So with that said, I will move on to Michelle van der Meer, and then after Michelle, Michelle, it would be Kelly Palomino. So Michelle, give me 1 second here. Okay, Michelle van der Meer, you should be able to unmute yourself.
Yes, I did. Can you hear me?
Yes, thank you.
Thank you. I'm a citizen of Quincy and of Washington State, obviously, and I'm just concerned. We're not in public school, we homeschool, but I would just like to say your policies are creating some of the shortage problems. And it would be nice if you just actually showed people who died with, people who died of, and people who died in the state of Washington of any cause. Because you keep using percentages, but we don't get to see the percentages, and most people are just scared. So we don't get to see that it's actually a very low number of people who die of coronavirus, and that people are dying of other things in the state of Washington. So I'm not for a vaccine mandate, but I am for people getting to choose. If you're high risk, get the vaccine. If you don't want to, don't force people. And all the other mandates kind of need to go as well. And somebody else, you can move on to somebody else now.
Okay, thank you, Michelle. The next individual, it should be Kelly Palomino, and then after Kelly, looks like it will be Terry Larson. Kelly, give me one moment here, and I will let you know when you can unmute yourself. Okay, Kelly Palomino, you should be able to unmute yourself.
Can you hear me?
Yep. Yes, absolutely.
Companies over the country now are coming out with stats that non-COVID deaths have gone up 40% as compared to pre-COVID average deaths from 2018 and before. Does Washington State have a total death rate from pre-2018 compared to current deaths in general? Has the health department contacted the insurance companies and funeral homes in Washington to come up with numbers? Is anyone concerned with over 1 million injuries reported to the VAERS report so far? The insurance companies are also reporting a huge uptick in long-term injury starting the very same time the vaccine rollout came out. The increase in death and injuries seems to correlate to vaccine injury, increasing in unexplainable deaths, spikes in cancer, or heart and stroke deaths. Why are we pushing something so injurious when the deaths from COVID have dropped to the pre-COVID normal flu deaths in levels?
Okay, and thank you, Kelly. I will move on to the next individual here. One moment. I will let Terry Larson know when you can unmute yourself, and after Terry Larson, it should be Deborah Cummings. Terry, give me one moment, please. All right, Terry Larson, you should be able to unmute yourself.
Hi, I'm Terry Larson from Roselia. And what I want to say, I'm a concerned parent, citizen, what I want to say is these government mandates have completely destroyed our economy. They've created division within our communities, within our counties, within our state. And it's stolen parts of our kids' lives that they will never get back. Those kids that graduated last year, there's parts of it that they will never get back that we were afforded. When we were in high school, we got those memories. They didn't. You created this mess. You created the shortages and staffing. You created the fear. And now you need to do the right thing to fix this now. And that is all I have to say.
Okay, thank you, Terry. I'll move on to the next individual. One moment, please. Okay, so next person is Deborah Cummings, and then after Deborah, it should be Pietra Gabo. Deborah, give me one moment, please, and I'll let you know when you can unmute. All right, Deborah Cummings, you should be able to unmute yourself here.
Okay. My name is Deborah Cummings. I am a mother, grandmother, have lived most of my adult life in Washington State. My late husband was a teacher, and several of my children are now teachers. I am concerned about several things. One, at any other time in history, this vaccine would have been considered a vaccine failure and would have stopped in January of last year because of the severe number of deaths and injuries that had been reported to VAERS in January of last year. My children, many of them were vaccine injured as children, and group health refused to vaccinate them anymore, yet those children now have no medical exemptions for these mandates to keep their jobs. This is wrong. Definitions are changing, and they're not based on science. The definitions seem to be erasing every kind of.
Thank you, Deborah. I'm sorry we ran out of time. Next individual is Pietra Gable. After Pietra, it should be Stacy Milligan. Pietra, give me one moment, and I will let you know when you can unmute yourself. Oh, it actually looks like Pietra Gable was with us earlier, but she's now no longer in our attendee list, unfortunately. I'm going to move on to Stacy Milligan. Stacy, give me one moment here, and I'll let you know when you can unmute. Then after Stacy Milligan, I will move on to Francis Mounts. One moment here. Okay, Stacy Milligan, you should be able to unmute yourself. Stacy Milligan, are you here with us to provide your comment? You should be able to unmute your microphone. Looks like Stacy Milligan's not at the microphone at the moment. I will move on to Francis Mounts, and then after Francis Mounts, I will move on to Twyla Emig. Francis, give me one moment, please, and I'll let you know when you can unmute yourself. Okay, Francis Mounts, you should be able to unmute your microphone. Francis Mounts, are you able to unmute your microphone to provide your comment?
Can you hear me now?
Yes, thank you.
It kept asking me questions, sorry. So I have been listening to everybody's complaint. I think they're pretty much all the same. And this country was founded on godly principles, and the incarnate rights that we inherited came from God, didn't come from any country or anybody else. It came from God. And what we're experiencing right now is ridiculous. And it's against the law, but nobody seems to care about that anymore. The governor, yeah, I could say a lot about him, but there's no point. It's worthless. The whole point of this is that you've got 400 and some people of athletes, professional athletes that have gotten sick. 137 of them have died. And these are professional athletes that are very healthy. What are you doing to the real people? It's sad. Can't wait till the crimes for humanities come out and you all go to jail. Thank you.
All right, thank you, Francis. I'm going to move on to the next individual here. Give me one moment to take a look. And that will be Twyla Emig. After Twyla Emig, I'm going to try to circle back to Dan Wood. I think his name was displayed differently. So after Twyla, I'll try to move on to Dan Wood. Twyla, give me one moment, please. Twyla Ewig. Okay, Twyla Emig, my apologies for mispronouncing that. You should be able to unmute yourself, Twyla Emig. Twyla Emig, are you here with us? You should be able to unmute your microphone and provide your public comment. I'm not hearing Twyla Emig, unfortunately. I will move on to the next individual. I'm going to try to call back on Dan Wood. I see it displayed as D Wood. Dan Wood, you should be able to unmute yourself. Dan Wood, are you able to unmute your microphone for public comment? It doesn't look like Dan Wood is here at the moment, unfortunately. I'm now going to move on to Catherine Austin. After Catherine Austin, I'll go on to Jeremy Hines. Catherine, give me one moment here and I will let you know when. Okay, Catherine Austin, you should be able to unmute your microphone. Catherine Austin, are you able to unmute your microphone for public comment? I'm not hearing anything from Catherine Austin at the moment. I will now move on to Jeremy Hines, and then after Jeremy Hines, I will go on to Zaina Carver. Jeremy, give me one moment here, and I'll let you know when. All right, Jeremy Hines, are you able to unmute your microphone?
I believe so.
Yeah, we can hear you, Jeremy. Thank you.
Excellent. Thank you. I just wanted to comment on the vaccine for children. The audacity of the TAG group to diminish my contribution from the rare disease community was rather abhorrent. I don't think that by saying it should be that my concerns should be ignored and talked about with my doctor, and then I can use the regular process for getting an exemption.
Thank you, Jeremy. I'm sorry we ran out of time. I will move on to the next individual here. And it should be Xana Carver. After Xana Carver, it should be Cindy Tucker. Xana, give me one moment, please. Okay, Xana Carver, you should be able to unmute your microphone.
Hello, this is Xana Carver. Can you hear me?
Yes, thank you.
Yes, I support Informed Choice Washington's petition that limits what you can mandate to only treatments that are not under emergency use and those who have undergone phase 3 clinical trials. Now, the lack of testing with these vaccines is appalling. They have not undergone any genotoxicity, teratogenicity, reproductive toxicity, cardiac toxicity, neurological toxicity, renal toxicity, hepatic toxicity. We cannot even consider mandating these for children. We do not know the long-term effects. When it usually takes 10 to 15 years for a vaccine to be developed, and these vaccines hit the market in 6 to 8 months, we should all have a huge red flag. And I also support what others have said about the VAERS database. It is extremely concerning. So please be cautious. Our children are precious. It should be a choice between families and their physician, and in no way mandated to attend public school. Thank you.
Thank you, Zana. We will now move on to the next individual. Give me one moment to take a look. And it will be Cindy Tucker. Then after Cindy Tucker, it will be Terry Hodges. Cindy, give me one moment, please. Okay, Cindy Tucker, you should be able to unmute your microphone.
All right. So I was wondering if the board is concerned with the increase in COVID cases in states and countries that are more highly vaxxed. As you can see from the comments from all the other people, we are aware of what's going on. We're not under a rock. We know what's happening. And I believe you've woken up a sleeping giant. So I would encourage you to highly look at what we're saying and take it to task. Thank you.
Thank you, Cindy. I'll move on to the next individual now. Looks like that will be Terry Hodges. And then after Terry Hodges, we have Beth Kirk. Terry, give me one moment, please. All right, Terry Hodges, you should be able to unmute your microphone.
Yes. Couple of questions for you to consider. One is, whatever happened to my body, my choice, or does that only apply to killing kids? The other is that under emergency use authorization statutes and Nuremberg Code, everyone is entitled to informed consent. I have never seen an instance in my family or friends where fully informed was administered, and then this whole mandate thing, and losing jobs and so on, certainly disqualifies the uncoerced consent aspect of that law.
Okay, Terry, I think we've ran out of time here, and I'll move on to the next individual here. One moment. And it looks like we have Beth Kirk. And after Beth Kirk, I'll move on to Lesko Brandon. 1 second, Beth, and I'll let you know when you're ready. All right, Beth Kirk, you should be able to unmute your microphone.
Yes, can you hear me?
Yes, thank you.
So I have issue with the mandate, piggybacking on what the gentleman before me was saying about consent and taking that away from the American people. And in the state of Washington, I teach first grade, and we don't have any instances of problems, and nor should these children be made to have a vaccine that has not been proven and has more than that had countless side effects, death, complete full injury, and it's just unconstitutional and unacceptable for people to tell parents that they have to vaccinate their children that potentially harm them for life or kill them. Thank you.
All right, thank you, Beth. We will move on to the next individual here. Let me take a look to see who that is. And we will have Lesko Brandon. I will let you know, Lesko, when you are ready, and then we will also have Don Olmsted after Lesko. So Lesko, give me 1 second. All right, we have Lesko Brandon. You should be able to unmute your microphone now. Lesko Brandon, are you here? You should be able to unmute your microphone. I'm not hearing Lesko, unfortunately, at the moment. I will move on to the next individual here up. Give me 1 moment to take a look. And that will be Don Olmsted. And after Don Olmsted, I'll let Kevin Miller. Don Olmsted, give me 1 moment, and I'll let you know when you're ready. Okay, Don Olmsted, you should be able to unmute your microphone.
Thank you. I'm Dawn Olmsted from Medical Lake, Washington. I just want to say no one on the board today has discussed that there are other viable treatments and preventative measures that can be taken to prevent or lessen the symptoms of the virus, such as ivermectin, HCQ, vitamin D, vitamin C. And no one is speaking to the VAERS system and the incredible amounts of vaccine injuries and deaths that have happened. It appears there's only one avenue that this board is discussing. And I just appeal to the board to legitimize other scientifically proven therapies and other than vaccines, and stop moving forward with this misinformation that vaccination, masking, and testing is the only way to navigate this virus. I appreciate your time.
Thank you, Don. I will now move on to the next individual. Give me 1 moment to take a look at that. And then we will now have Kevin Miller. Then after Kevin Miller, it will be Peter/Rosemary Dorn. Kevin Miller, give me 1 moment and I will let you know when you can unmute yourself. Okay, Kevin Miller, you should be able to unmute your microphone. Kevin Miller, are you available to unmute your microphone and provide your public comment?
Yes, can you hear me now?
Yes, we can hear you, Kevin. Thank you.
Okay, great. So yes, my name is Kevin Miller. I was born in Toppenish, Washington. I now reside closer to the gorge these days, a little closer towards the Oregon side. So I get to see both sides of this whole thing. And I agree and would like to reiterate with what has been said as far as these mandates are atrocious to the max. And an uprising, as the one lady mentioned before, I mean, that's not far out of scope when you start to trample on individuals to be discussed. Going to mandate anything close to type of draconian policies that are being presented. Definitely. Thank you.
Thank you, Kevin. I'll move on to the next individual now. Give me 1 moment to take a look at the list here. And we will now have Peter/Rosemary Dorn. And then after Peter and Rosemary Dorn, it will be Jason Miller. Give me 1 moment for Peter and Rosemary. And just to clarify, Peter and Rosemary have, it's in their display name, so it should be one individual, I believe. Peter and Rosemary Dorn, you should now be able to unmute your microphone here. Peter and Rosemary Dorn, are you available to unmute your microphone and provide your public comment? And it sounds like Peter and Rosemary Dorn are not here at the moment. I will now move on to the next individual here. And let me take a look here. And that should be Jason Miller. After Jason Miller, it will be Maureen Kircher. Jason, give me one moment here. Okay, Jason Miller, you should be able to unmute your microphone.
Hey, can you hear me?
Yes, Jason, thank you.
Hey, great. Hey, I want to thank you guys for putting on this and taking a public comments. Father of two, been in the education system for several years, worked with kids, and I just know that their immune systems can handle this virus without the mandate. I think it's terrible without knowing the long-term effects. You know, I don't plan on getting my kids vaccinated if it's a mandate in order for them to attend public schools. I just think it's a terrible idea. I think there needs to be more research and what the long-term effects are. Thank you.
All right, thank you, Jason. I will now move on to the next individual on our list. Give me one moment. My computer is a bit slow here. My apologies. Okay, my list was actually still loading. I apologize for the next individual.
Nathan, this is Christy. That you had said Maureen Kircher is next.
Oh yes, Maureen Kircher. Thank you, Christy.
Maureen, you should be able to unmute yourself. All right, Nathan, it doesn't look like Maureen is there to unmute herself. I'm not sure who's next on your list.
Okay, thank you, Christy. I will go ahead and take a look here. Okay, so I'm gonna go ahead and move on to Jennifer Olsen. And then after Jennifer Olsen, it should be Guru Desiree. Give me one moment, Jennifer, and I will let you know when you can unmute your microphone. Okay, Jennifer Olsen, you should be able to unmute your microphone. Jennifer Olsen, are you available to unmute your microphone and provide your public comment? Okay, I'm not hearing anything from Jennifer at the moment, fortunately. I'll move on to the next individual. And that'll be Giroux Desiree. And then after Giroux Desiree, it should be Alan Hoffer. So give me 1 second, Giroux. And my apologies if I'm pronouncing that wrong. We have Giroux Desiree. You should be able to unmute your microphone.
Hello. Can you hear me?
Yes, we can hear you, Giroux. Thank you.
Hi, my name is actually Desiree Giroux. I'm a Washington State resident, mother, business manager, and taxpayer. I am calling in regarding the discussion regarding the revisions to WAC 246-100 and -105. The fact that we have WAC code 246-100 is appalling to me in so many ways. We as Washington residents are a part of America. We are free residents, and to give local health authorities the ability to literally haul people away like they are part of the Gestapo is disgusting to me. Furthermore, the revision to WAC code 246-105, also appalling. We are taxpayers in Washington. Schools are public and paid for by tax dollars. There should be no way that you can deny a child entrance into a school simply because their parents choose what to do with their bodies. People should have bodily autonomy.
Thank you, Desiree Giroux. Sorry, we have to move on to the next individual here. Give me one moment. And it looks like the next individual will be Alan Hoffer. And then after Alan Hoffer, it will be Crystal Henderson. Alan, give me one moment here and I'll let you know when you can unmute yourself. Okay, Alan Hoffer, you should be able to unmute your microphone.
Can you hear me, sir?
Yes, thank you, Alan.
Thank you. I've posted some of my stuff, and I sent an email to you guys, and I also posted in the question and answers. There's some really disturbing information in there that just came available 2 days ago. It looks like the government has known that this vaccine is a poor vaccine. It doesn't really work whatsoever. And one of the reasons why, it's an animal reservoir virus. We currently have no cures for animal reservoir viruses. I yield back the rest of my time. Thank you, sir.
Alrighty, thank you, Alan. I'll now move on to the next individual, and that will be, Crystal Henderson. And then after Crystal Henderson, I'll move on to Dr. Agnes first. Crystal, give me one moment here, and I'll let you know when you are ready to unmute your microphone. Okay, Crystal Henderson, you should be able to unmute your microphone. Crystal Henderson, are you available to unmute your microphone and provide your public comment? Okay, it does not sound like Crystal Henderson is available. I will go ahead and move on to the next individual. Give me one moment to take a look here. And that will be Dr. Agnes first. And then after Dr. Agnes first, I see Margaret Nartia. Dr. Agnes first, let me go ahead and give you the ability, and I'll let you know when you're ready. One moment. Okay, Dr. Agnes first, you should be able to unmute your microphone. Dr. Agnes first, are you available to unmute your microphone and provide your public comment? I'm not hearing anything from Dr. Agnes first at the moment. I will move on to our next individual. Let me take a look at this momentarily here. And that will be Margaret Nartia. And then after Margaret Nartia, I see Steechan Joanne. I think it might be Joanne Steechan. Margaret, I'll let you know when you're ready. Give me one moment. Okay, Margaret Nartia, you should be able to unmute your microphone. Margaret Nartia, are you available to unmute your microphone and provide your public comment? Okay, and I'm not hearing Margaret Nartia. I'll move on to our next individual. Give me one moment to take a look. And we have Steechan Joanne. And then after Steechan Joanne, I see Carly Reid. Give me 1 second, Steechan Joanne. And my apologies, it is Joanne Steechan. Joanne Steechan, you should be able to unmute your microphone right now.
Thank you. Can you hear me?
Yes, Joanne, thank you.
Thank you. Yes, I'll try to speak very quickly. What we have learned throughout the pandemic are the many ways that we have been lied to. The models created by the Imperial College, Niall Ferguson, showing millions of US deaths projected were wrong, gravely exaggerated. The PCR tests given were created extreme high amounts of false positives because of this amount of cycles that were used. The inventor said they should never be used as a diagnostic tool at all. Asymptomatic transmission is a fabrication, according to Dr. Michael Yaden, Dr. Peter McCullough, and other experts now. The safe, effective, inexpensive treatments, especially hydroxychloroquine, ivermectin, were mocked, suppressed, censored, and doctors were threatened for using them to safely save thousands of patients. Why would this be? Because the emergency.
Okay, and thank you, Joanne Station. I'm sorry we ran out of time. I'll move on to our next individual here. Give me one moment. And I see Carly Reid. After Carly Reid, I'll call on Michael Shinek. Carly, give me one moment here and I'll let you know when you should be able to unmute your microphone. Okay, Carly Reid, you should be able to unmute your microphone.
Can you hear me?
Yes, Carly, thank you.
I'm astonished at what I'm seeing on the slides and what the comments and stuff that I'm hearing. There's no comment so far of what I'm hearing for people who are recovered from COVID, natural immunities. There's no discussion of that. There's no mention of that even included in the numbers. And yet we are treated as second-class citizens and have no importance at this point right now, and losing our job, losing everything that we have. And that's not just, I'm talking about lots of people in this state. And now you want to do our children and eliminate their education? You're going to have a tsunami of kids coming out of the school if you push the mandate. A tsunami. Parents will pull the kids out. And it will crush the educational system if you push the mandate for the kids.
Okay, and thank you, Carly. Sorry we ran out of time. I'll move on to our next individual here. I'll take a look at our list here. Give me one moment. And I see Michael Schenk, my apologies, Michael Schenk. And then after Michael, I see Lesko Brandon. Michael Schenk, give me one moment and I'll let you know when you are ready. Okay, Michael Schenk, you should be able to unmute your microphone.
Test?
Yes, we can hear you, Michael. Thank you.
All right. Hi, Keith and the board. Definitions in WACs provide context for all infectious diseases, not just HIV and AIDS. Unfortunately, code tends to be applied across the board. Removing local control is something I will never support. In WAC 246.100, the new number 17 strikes a term for the period of communicability or contamination, excuse me, leaving incarceration, isolation, quarantine open indefinitely, inclusive of any disease du jour. As an aside, regarding new definition number 20, COVID and HIV are not curable. They are survivable. The quote, vaccine does not make a carrier unable to transmit the disease either. As a challenge to Dr. Umair, as of this morning, 80% of Confluence Health patients, COVID patients in Wenatchee are, quote, fully vaccinated. Item 11, adopt it. I'm not asking, I'm insisting. Will you go on the record that you will not be forcibly trying to make a law to forcibly administer any vaccine, and you will that the non-compliant.
Thank you, Michael. I'm sorry we ran out of time. I will move on to our next individual here. Give me one moment to take a look. And I see that is Lesko Brandon. After Lesko Brandon, I will call on Russell Rivoli. Lesko, give me one moment and I'll let you know when you can unmute your microphone. Okay, let's go, Brandon. You should be able to unmute your microphone.
Hi, yes. I wanted to say that part of the problem that we're seeing is that these vaccines don't work. They don't meet the minimum requirement of a vaccine by the state's guidelines. And also, it doesn't seem that anyone is looking at the fact that the absolute risk reduction is not the same as the relative risk reduction. Absolute risk reduction makes it look like these vaccines work at about 90%. They've waned by efficacy down to 30%. And the relative risk reduction is only about 1%. So if you take a vaccine, you're only 1% better from someone that didn't take the vaccine. And with kids, they have negligible risk for this COVID. So by installing this, you're going to lose a lot of kids at school. Parents will drop their kids not only out of school, but most likely leave the state. So that's something that the state and the medical doctors really need to look at. Actual data, not a sales slogan of safe and effective. They're not the same thing.
Okay, thank you, Lesko. Move on to our next individual here. Give me one moment to take a look at that. Okay, and I see Russell Reevely, and then after Russell Reevely, it's Diane Swingler. Russell, give me one moment, and I'll let you know when you can unmute your microphone. All right, Russell Reevely, you should be able to unmute your microphone.
Yes, hello, thank you for taking my call. My complaint is simply the paradigm that we've moved away from the political and the rights of the citizens, but the science really sucks that you guys are playing this playbook by, and I really would ask you to kind of step back and look at some real science and try to make the decision informedly, and even pick up a nice copy of The Real Anthony Fauci by Robert F. Kennedy Jr. It might open your eyes a little bit. Thank you.
Thank you, Russell. I will now move on to our next individual. Let me take a look at that really quickly. And I see that is Diane Swingler. After Diane Swingler, I will call on Lori Cook. Diane, give me one moment here, and I'll let you know when you can unmute your microphone. Okay, Diane Swingler, my apologies. You should be able to unmute your microphone.
Hi, thank you for taking me. I'm sorry, I wasn't prepared because I didn't think that I was signed up, but I do want to reiterate, I am concerned about the vaccine mandate for the kids. For some of the points that have been already expressed, these have not been tried. The trials have not been done. They're still for long-term effects on the kids. They are healthy. They have a low transmission, and the vaccinated people have shown that they also transmit. So I do not see any reason that we should be mandating vaccines for our kids. And furthermore, the parents need to be the ones to decide on medical issues for their kids and not the schools. Now, I understand that there are vaccines that they do have to participate. This is a vaccine that is untried, and we haven't seen the informed consent necessarily. And so parents still need to decide what's best for their own kids. And we have seen a number of issues with myocarditis with the
Thank you, Diane. Sorry, we ran out of time. I will move on to our next individual.
So Nathan?
Oh, yes.
Hey, we are now at 65 minutes, so we're 15 minutes over. So we're going to take two more, and then we have to move on to other business for today, okay? Tom and Samantha, after we finish these next two, we're going to skip agenda item 7 and move to agenda item 8, and we'll move 7 to the afternoon. So here in the next 5 minutes, if you two can be ready for number 8, that would be great. All right, thank you, Nathan. Two more, please.
Thank you, Keith. Yes, two more individuals. It will be Lori Cook. After Lori Cook, it will be Julie Britt. Lori, give me one moment to, and I'll let you know when you can unmute your microphone. All right, Lori Cook, you should be able to unmute your microphone here.
Hi, do you hear me?
Yes, Lori, thank you.
Okay, wonderful. First off, I'm kind of disappointed in the way this has been laid out. The fact that you guys are not answering any questions really leaves a problem for the citizens, because we're supposed to have the right to make a decision here. The idea of mandating someone else to choose whether my children get vaccinated or not is completely wrong. Not to mention, those of us who get state insurance, we don't qualify for any exemptions to the vaccines, which is not right. My doctors, I've seen 2 different doctors lose their jobs because they did not push the vaccine. for every person who came through. It is not right. And you will see a mass exodus if you try to mandate that all children get a vaccine that is not even fully tested. It doesn't even make sense that this is even placed as a question before the real.
All right, thank you, Lori. I'm sorry we ran out of time. I'll move on to our next last individual here for public comment. That will be Julie Britt. Julie, give me one moment here. Okay, Julie Britt, you should be able to unmute your microphone.
Can you hear me?
Yes, Julie, thank you.
I think what you're doing sounds like what happened in Nazi Germany. And you know what happened to those folks. I think this is wrong. My physician told me I should not have the vaccine, and I don't think the government should mandate that I should. What happened to my body, my choice? You know, if the Democrats want this as far as abortions, it should also be for any other medical procedure or medication. And I think what you're doing is wrong, it's unconstitutional, and it's immoral.
All right. Well, we are going to bring public comment to a close. And again, we're now sitting at about 12:30, so we did go about 20 minutes over to try and fit more people in. Thank you, everyone, for your public comments. We appreciate it. Next, we're going to move to agenda item number 8, which is a briefing on the Immunization Technical Advisory Group.